Good morning, bonjour. I'm here in the capacity of President-elect for the Canadian Counselling and Psychotherapy Association, the CCPA. I represent more than 12,000 members that provide essential mental health services across Canada. I would like to speak today about the significant mental health trends affecting children and how the government can take immediate action to relieve some of the burden to Canadians on the cost of mental health care. Children in Canada are desperate for and yet struggling to access mental health support. There is clear and growing need for help, but our system is failing these children. There is long wait times that demonstrate how the demand for services outweighs the capacity of providers. Les thérapeutes en
Therapists, counselors, and psychotherapists cannot meet the demand, but they are ready to do so. They are healthcare professionals in mental health services, and very available, as has been shown during the period of the pandemic.
Mental health care supports by increasing accessibility to providers is essential to pandemic recovery and to thriving and healthy society. Despite healthcare being a provincially regulated matter, there are small and actionable yet impactful federal policies and legislation that can be amended in order to improve supply and access to qualified mental health care providers in Canada. Mr. Chair, at present, counselling therapists and psychotherapists are the only regulated mental health service providers that must remit tax on their services. Physicians, psychiatrists, registered nurses, registered psychiatric nurses, psychologists, occupational therapists, and social workers are all exempt from GST, HST on their psychotherapy services. Les thérapeutes en
Counseling therapists and psychotherapists are excluded from this exemption. This situation contributes to reducing access to mental health services for children, and this by creating unnecessary financial pressure.
Counselling therapy, psychotherapy meets the threshold for tax exemption in the Excise Tax Act as it is regulated in 5 provinces. However, because the profession does not regulate the same title in all 5 provinces, title being a provincial decision, the Finance Department, the Department of Finance if you prefer, does not accept the counselling therapists and psychotherapists are the same profession. In order to meet that minimum threshold, the profession is the same in all but name. Counselling therapists and psychotherapists across Canada share common scope of practice, abide by similar codes of ethics and standards of practice, have a comparable training and education profile, and a commitment and obligation to ongoing continuing education. They are qualified, competent, and available to meet the skyrocketing mental health care needs of children in Canada, yet the additional cost of GST and HST tax on their services is limiting their capacity to serve their communities and those seeking care.
To ensure universal access to all mental health professionals, the services offered by therapists and psychotherapists should be tax-free.
Would enable a child seeking care to access a few additional sessions over the span of a year. These extra sessions can make the difference between a child's ability to fully integrate their learnings and positive changes and habits for improved well-being. We call on the committee to support CCPA's recommendation to the federal government to legislatively amend the Excise Tax Act through a financial bill that adds the profession of counselling therapy and psychotherapy to the list of GST, HST exempt healthcare professionals. Merci beaucoup.
Thank you very much. I'll be happy to take your questions in English or French.